us on the revision session, I thought again I'd summarise the key points that we went through using this PowerPoint. So first off, we looked at flexibility, so the application of the flexibility. Now, what we need to know about flexibility this is from the specification, so if you want to pause and read through that, you can, but we're going to go through one thing at a time. In terms of definitions, the key determinant about obviously flexibility is about how far we can move joints, but static being no reference to speed or movement. So generally, like how far can the joint move? When we think of maybe a dancer going into the splits, there's no kind of speed required for that. Whereas dynamic flexibility is the range of movement joint with reference to speed. So if you think of like a high hurdler, 110 meter high hurdler, they need to kind of perform the splits in the air, but do it very, very quickly. Or maybe a dancer doing a split leap, or a gymnast doing in like an aerial split movement. So there's a need for good range of flexibility, but also they need to do it quickly. In terms of the factors affecting, they're a little bit easier, these factors affecting. Obviously, we've got the type of joints, the length of the elasticity in surrounding tissues, gender and age. But not only knowing what they are, we need to know kind of what the effect is. So if we take a type of joint, we're looking at things like the shoulder joint is a ball and socket joint. That is more flexible than the hinge, because obviously the hinge joint at the elbow can only flex and extend. The ball and socket joint at the shoulder can flex, extend, abduct, adduct, horizontal flex, horizontal extend, and rotate. So it's vastly different number of movements you got there. The length and elasticity of surrounding tissues. We're talking about soft tissues around joints there. So things like the ligaments that hold the joint together. We're looking at the tendons that attach the muscle to bones, and the actual muscle that attaches around the joint as well. So obviously, if the muscle is longer, if it's more elastic, then flexibility will be greater. Whereas if the length and elasticity of those things is less, then flexibility will be decreased. With the gender effect, this is the females tend to, on average, have greater flexibility than the males. That's down to the estrogen, that obviously the female sex hormone, and also elastin. So we know at certain times of females' lives when they have to give birth, they do need sort of great flexibility to give birth. So that's kind of a reason that flexibility for childbirth is something that affects other joints. And with the age, as you get older, you see a decrease in flexibility. Generally, by the age of 11, people have kind of maxed out. When you get into your teenage years, it starts to deteriorate unless, obviously, you're training. So remember there, it's not just saying what the factor is. We need to be able to apply what that factor actually means to flexibility. If we look at method of assessment, again, they're quite simple. These ones, sit and reach test, people are generally familiar with. We need to know the methodology. So just have a look up about how you actually perform the test. Goniometry is slightly more tricky, because goniometry would use like a protractor, and we can measure the flexibility of every single joint, which is clearly an advantage to that test. A sit and reach test will give you flexibility of like lower back and hamstring, whereas goniometry, you can measure every single joint on both sides, so it gives you a much wider gauge. In terms of the advantage of a sit and reach test, it's very easy, it's very cheap. Goniometry advantage, you can measure all joints. The disadvantage is sit and reach test, it's a limited range of flexibility being measured. It might be unsuitable for some sports, whereas goniometry, although it's very, very accurate, and you get a detailed picture of all-round flexibility, it is very time-consuming, and it is a lot harder to administer. With the types of training, we need to kind of focus on what flexibility training is all about. So the two kind of times, there's maintenance stretching, and maintenance stretching is something we would generally do during a warm-up. So in a warm-up, we're not trying to increase our overall flexibility, we're trying to sort of get ourselves up to our current, like, I suppose, ceiling of flexibility. Developmental stretching, whereas, is maybe more of a longer term aim, where we're actually doing a stretch training session. We're holding them stretches a little bit longer, and the aim of that session is to actually increase our overall flexibility. You can see the different methods down there. They've got static, asymmetric, PNF, ballistic, and dynamic. Now, static stretching can be split into either active static stretching or passive. Now, what makes it active or passive is who is providing the force. So an active stretch is where you as an individual are applying the force. So I don't know, if you put your heel to your bum and hold your foot, like the quadricep stretch that we know, that will be an active stretch, because you are physically pulling that leg apart, pulling that knee joint apart to stretch the quadricep. Whereas a passive stretch might be if you lay on your back and you your teammate lifts your leg and you stretch your hamstring that way, that will be a passive stretch because someone else or gravity might be using the stretch there. The isometric stretch and PNF stretch are very, very similar. I'll go over, you can read up about isometric, but if I go over PNF stretching, that's slightly harder. That's kind of a partner stretch where the aim of this is you, like if you do your hamstring, you might line your back, your partner pushes your straight leg up to flex your hip as far as you can go. Now, at just beyond the range of movements, your partner would resist and you would try and push your partner back, giving an isometric contraction for maybe like 4, 5, 6 seconds. You then relax and then you stretch it a little bit further. And bit by bit, you'll see you can stretch that little bit further. What PNF stretching is doing is it's overriding the stretch reflex mechanism. So if you go back, if you think of doing a sit and reach test, a lot of us, when we're doing it, when we get to a full range of movement, we'll see our knees pop up. That's kind of the muscle's protective mechanism. So when our knees pop up during a sit and reach test, that's our hamstring saying, you know what, we've stretched a little bit far enough. What PNF stretch is doing is overriding that kind of safety mechanism. The sort of muscle spindles, when they detect they're getting too stretched, they would contract and bring the muscle back together. So PNF stretching is overriding that, which again increases our flexibility. Obviously, a negative of that, if we're overriding the stretch reflex mechanism, we're kind of doing away with a safety mechanism, so it can lead to injury. Another thing with PNF stretching is because it's a partner stretch, it can be quite dangerous because your partner might push your joints a little bit further. So again, read up in the book on that. Ballistic and dynamic stretching are more kind of moving stretches. Ballistic tends to be kind of bouncy, where kind of uncontrolled bouncing. But some sports obviously require that kind of thing. Maybe like gymnastic movements may require that. Whereas dynamic stretching is slowly taking your muscles through their range of movement, and dynamic like open the gate, close the gates. They're usually used in warm-ups when we're trying to increase the flexibility. So that's what stretching is. In terms of the application of fit, it's slightly harder than your strength training and your aerobic training. What you should be looking at is everybody really should be doing 2 sessions at least of flexibility training a week, just to kind of maintain it. As we said, from the age of 11 we use it, so you lot are getting sort of 16, 17, 18 now, me and Phil late 30s, early 40s. It's something we do need to be doing. In terms of the intensity, rather than a percentage, the intensity is kind of subjective. It's just beyond your point of resistance, and obviously the gymnastics, like Alice has been a great gymnast, her flexibility will be significantly better than mine and Phil's. So she pushes her joints beyond her range of movement. Me and Phil push them beyond ours. And then in terms of the time, in your warm-ups, you're normally doing it, 10, 15 seconds. If it's developmental training, we want to be probably pushing like 25, 30 seconds, maybe 3 times per stretch. So when stretching session might be 25, 30 minutes, but it obviously is a vital part of training. In terms of adaptations, what we're looking at is, if we go back to the factors affecting, remember we had age, we had gender, we had type of joint, and also the elasticity of connective tissues. Now, clearly, age, gender, and type of joint we can't affect because we are kind of stuck with them, but we can change what we do. The resting length of the connective tissue, so we're looking at the muscles, the ligaments, the tendons, what they do. The range of movement increases before that stretch reflex that we mentioned with the PNF stretching is initiated. The elasticity of muscles, so they become more bouncy. And what it is we're actually trying to affect is the inhibition of the antagonist muscle. So you think if you kick a football, you're more likely to pull your hamstring, despite you extending your knee, because it's the antagonist that gets really, really strained at the end of a range of movement as it tries to control the end of that movement. And the adaptations to training, they will bring about an increased power and a decreased risk of muscular injury. And the power increases because if we can move our limbs through a greater range of movement, we can apply that force over a greater period of time. With the lifestyle factors, if we look at this again, we need to know briefly some cardiovascular disease. We need to look at respiratory disease. With cardiovascular disease, as a nice little starter, if you get a 10-mark question, there's like 7 million people living with CVD, cardiovascular disease, and it says like 75% is thought to be preventable. So as you move through your education in sports science, exercise science, this is a big thing that you need to be getting into. Now, in the book, it deals with atherosclerosis, coronary heart disease, heart attack, and stroke. So I've set it out slightly differently. Atherosclerosis is inflammation and blockage within an artery. Okay, so irrespective of where the artery is, atherosclerosis, when we get fatty deposits building up on the walls of arteries, the more fat we get on the walls, the less blood can get through and the blood pressure goes up. Now, that can affect us in many ways, but the two ways we need to know about in terms of A-level PE, if that blockage occurs within the coronary arteries, so as the blood exits the left ventricle into the aorta, there's arteries that go into the walls of the heart. If the atherosclerosis is affecting the coronary heart. That's what we term coronary heart disease. So coronary heart disease is disease within the heart itself, or within the blood vessels of the heart. If you block the coronary arteries, that can manifest itself as a heart attack, where there's a blockage. Depending on the severity, if it's a total blockage, obviously everything beyond that blockage, the heart would start to die. Eventually, the heart stops working. So it's critical that if people in that situation seek medical attention quickly. So heart attack obviously can be fatal. If the atherosclerosis affects the cerebral artery, and the cerebral artery is the artery that goes to the brain. So the coronary artery goes into the heart. The cerebral artery is what heads up to the brain. If that same thing, that atherosclerosis, so we get a build-up of the artery, if the artery becomes increasingly blocked, a blockage in the brain manifests itself as a stroke. And as we know, strokes can be fatal, or they can lose movement on the side of your body. So that's cardiovascular disease. In terms of training effects, we need to know if we train, lots of the training effects for CVD is cardiovascular training. The HDL-LDL ratio, high-density lipoproteins being the good fats, the LDLs can actually reduce the LDLs, can remove the inflammation from the arterial walls. So if we increase the HDLs in our body, we're unlikely to get the atherosclerosis. If our arterioles are more elastic, they're less likely to block, because if there is a blockage, they can become elastic and the blood can get past. If they're elastic, they're less likely to suffer those blockages. If the viscosity of the blood, so the thickness of the blood, if we decrease that, again, it's less effective with the blockage because it can slip through. Remember, like water and golden syrup. Water, less viscous. Golden syrup, very viscous. So water would flow, and less viscous blood would flow a lot quicker and a lot easier. The coronary circulation, obviously, if we can improve that and reduce the blockages within the heart, then we're less likely to have a heart attack. And the cardiac hypertrophy, having a stronger heart, pumps blood at a greater rate, and again, it reduces the chance of getting those blockages. The decreased body fat, how that can affect it, it reduces the stress on the internal organs, helps us manage our weight, helps us drop blood pressure, which again helps the cardiovascular health, because if our blood pressure goes up, it causes a lot of stress on the heart. The blood flow obviously improving, which means we can oxygenate it better, we can get to where it's going, so we live a much healthier lifestyle. And a bit of a spelling mistake there, the stroke risk is reduced. If our blood pressure is low, we're a lot less chance of suffering a stroke. In terms of respiratory disease, it's quite short, this one. We just need to know what asthma, students tend to know what asthma is, a constriction of airways, and that can be due to pollutants, like sometimes with animal hair, it could be pollen. In springtime, it can be cold air. And EIA, the exercise-induced asthma, is what people tend to get, what people are affected when they are participating in sport. And it can be like humid environments, so like damp environments like swimming pools. It can be like cold areas, so what if you're playing football in the wintertime. And what we can offset that by obviously the use of inhalers. So you've got preventative inhalers that you take prior. We've got kind of reactive inhalers that you would take if you feel you at the onset of like an asthma situation, but also that warming up gradually, getting our body ready for the sport, and respiratory muscle training would affect it, because if we're constricting the airways, having stronger muscles can enable us to kind of offset the effects of that. And COPD, chronic obstructive pulmonary disease, very similar to atherosclerosis, but this time it's blockaging of the airways. So if people like smoking, can cause that. If we're blocking airways, obviously we restrict the amount of air we can get into our alveoli, which the knock-on effect of that would be the gaseous exchange would go down. In terms of training effects for this, again, like I mentioned earlier, if we train regularly, our respiratory muscles are stronger, so we can maybe overcome the issues with the blocked arteries of the COPD, or the restricted arteries of asthma. We get decreased resting and submax breathing rate, which means we can breathe. We're not breathing as heavily, so there's less stress on the respiratory system. And then increasing the use of lung tissue, that offsets the rate of infection. If we actually using different parts of the lungs, we can obviously offset the rate at which infection settles in. And if we have an increased alveolar surface area, we have more gaseous exchange. So maybe if we have an effect in one part of the lungs, the more surface area we've got where we can have gas exchange, the impacts of that are greatly reduced. But as ever, I mean, like read through the bits of the book. That's just a very, very quick summary of the topic, and hopefully you can join us for the next one. So take care. Goodbye.